So I do want to thank you all for the opportunity to speak with you this afternoon and talk about the American Nurses Association and our voice in healthcare reform. A little bit about the ANA, or the American Nurses Association. We are the nation's largest healthcare entity. We represent the 3.6 million registered nurses that are practicing in the United States. So obviously our voice goes a long way, or we'd like to think that it goes a long way. ANA has been involved in legislative, the agenda for quite some time. As you can see here, when the legislation was signed that created Medicare and Medicaid back in 1965, ANA was there, at the signing there. This is the lady in the hat there on your right. Was our current president at that time, Joellen. She worked a lot with President Johnson and his administration to ensure that some of the essentials of Medicare and Medicaid did include nursing. So even back 50 plus years ago, we were there to ensure that that would be going on. Most recently, we've been involved, obviously, also with the signing of the Affordable Care Act. Whatever your personal position is on the ACA, whether you think it's a good idea or not, I think I'm in an audience where we think it's a good idea. I hope you would appreciate that ANA continues to work diligently to ensure that nurses are at the table. ANA's been involved with healthcare reform because if we're not there, then the perspective of the registered nurse would not have been included in the legislation. So again, on the right-hand side of your screen, the young lady here, that was our current president at that time, President Rebecca Patton. But again, this is just to give you an idea of how ANA has had an influence when it comes to healthcare legislation. So obviously, though, a lot has happened since the ACA was first passed. The law that has survived, obviously, two major Supreme Court challenges. ANA was at the Supreme Court when the decision was handed down in the case of King versus Verwell. We were pleased that the court preserved tax credit subsidies that would allow millions of Americans to obtain health insurance coverage. So the photo is on the homepage of the Washington Post and newspapers across the country that you're seeing here. But as a result of that, though, 20 million Americans have gained insurance coverage thanks to the Affordable Care Act. The uninsured rate, obviously, during that time has never been lower. So it's also, though, important to note that ANA, as I mentioned, has a very long history for healthcare transformation. As early as 1991, ANA collaborated with the nursing community to develop nursing's agenda for healthcare reform. Our blueprint resulted in the endorsement by dozens of nursing and healthcare organizations, and healthcare reform obviously has been a priority for ANA for decades. And I want you to keep in mind about the nursing and healthcare, the nursing agenda for healthcare reform, because when we do talk about the current legislation that is before the Senate, we'll talk about some of the ideas that were included in that and how that misses the mark. So since the inauguration of President Trump as the 45th President of the United States, obviously issues continue to move very quickly in Washington, D.C. As much also it affects nurses and how we as nurses practice. So our ANA staff is constantly on Capitol Hill working to analyze legislation, regulatory proposals, and also to represent your ideas that we get from you, when we're caring for you as our patients, and also as we're seeing the effects of healthcare and how that is affecting you as well. I think one of the most important things to stress, ANA firmly believes that healthcare is a right, not a privilege, and also that as nurses, being at the grassroots or at the end of the spectrum and seeing how legislation that is passed in Washington affects you at the local level, this is how we're using our voice to try to influence legislators that they need to listen to those who are seeing what the effects of their legislation is doing on a daily basis. So with that, though, there's the health system activities is a top tier priority for the American Nurses Association. It's part of our 2017 to 2020 strategic plan. So as you can see there, those various topics there: staffing, care coordination, health systems activities, healthy nurse, healthy nation. Our thing there is that obviously part of being able to care for you, our patients and people within the community, is that we have to care for ourselves. You know, if you're not a healthy nurse, then you know, the work that you're able to do is going to make you a little bit more tired, so to speak, and you won't be able to really fulfill that. So that's a huge struggle that or a program that we're pushing forth this year. This is known as the Year of the Healthy Nurse. So we continue to engage in activities on Capitol Hill, as well as key allies and stakeholders in the Washington, D.C. area to ensure that these top priorities are addressed. Now, two of President Trump's cabinet appointees are especially important to nursing and healthcare at large. Obviously, Health and Human Services Secretary Tom Price, as you remember, the Senate confirmed Representative Price for Health and Human Services Secretary on a party line vote of 52 to 47. He's a physician, former congressman. He perhaps is best known for being the author of the prominent ACA replacement plan. And then there's the VA Secretary David Sulkin. He's another physician who's been confirmed to lead the Department of Veterans Affairs. The VA, if you did not know it, is the nation's largest employer of nurses. Dr. Sulkin was previously the Undersecretary for Veterans for the Veterans Health Administration. ANA has worked with him in the past and will continue to work with him to advocate for the full practice authority of 4 advanced practice roles of nurses. That's nurse practitioners, nurse midwives, CRNAs, and also clinical nurse specialists within the VA system, which is helping to alleviate the physician shortage. So, you know, so these are individuals, as we stated, they're very key to the health care that is distributed. However, the million-dollar question is, how do we promote safety and quality in a healthcare system that sometimes seems like a very maddening complex? It's akin to sort of redesigning a airliner in mid-flight, so to speak. So the question is, you know, what are we going to do about that? So, as we mentioned, the retaining focus is how do we reduce the volume, but also have good value, or in other words, how do we increase the quality of care while simultaneously reducing healthcare costs? Because obviously we recognize that healthcare is increasing, you know, everywhere you turn. So if you remember, I mentioned about the principles of the health system transformation that ANA started with in 1991, and it subsequently has been readjusted over the years. And these 4 topics here, or points, are the ones that we are addressing now that we see as the major stumbling blocks, if you will, to healthcare reform. That is access, cost, quality, and workforce. And I'll talk about each one of those. But we use these 4 principles to evaluate the House Republicans' long-awaited health reform legislation. The American Health Care Act, or AHCA, ANA concluded that this act does not align with our principles to deliver you know, good quality health care. And as a result of that, we did deliver a letter to Capitol Hill leadership and with a media statement that was outlining our opposition to that. We still remain steadfastly opposed to the AHCA because it fails to fulfill our principles, ensuring health care access, quality, affordability for all Americans. So moving forward, ANA urges the Senate to draft a comprehensive health care plan that protects Americans from being denied insurance coverage because of pre-existing conditions and providing access to affordable health care insurance coverage plans that offer a minimal standard of benefits. So our response has been widely reported in the news media, including but not limited to ANA's current president, Pam Cipriano, appearing on MSNBC, the New York Times, CNN, the Hill, where nurses joined doctors, hospitals, and ripping apart the GOP health plan. Forbes had the title there that nurses blast Trump care as dangerous or danger to the public, among other things too, such as the Atlantic, the Boston Globe, and of course CBS News as well. So as you can tell, we've gotten really good coverage with that. So on Monday, May 24th, the Nonpartisan Congressional Budget Office released its analysis of the American Health Care Act, and they estimated that the AHCA would leave about 23 million more Americans uninsured by 2026 than if the current law remained in place, including 14 million by 2018, when premiums were expected to increase by 20% more than under the current law. So additionally, direct federal funding for Medicaid would be decreased by $880 billion, resulting in 14 million fewer enrollees in 2026. Seniors, most of all, will fare even worse because according to the AARP, 25 million people aged 50 to 64 have pre-existing conditions and would face a much higher premium, thousands of dollars a year that many would not be able to afford. And I might also add that every day for the next 30 years, 10,000 Americans are turning 65 and older, and as you know, we are living longer as well. So those priorities that we talked about, accessible health care, what ANA is going to continue to work towards is that for accessible health care is that universal access to should be a standard packet of any essential healthcare services to all clients and to all residents. And when we talk about access, we're not just saying that it should be their access and then means of being able to get there or being able to have health care within your community. Those are some of the things that we need to talk about. Having it on paper is one thing, but physically having a place where people can go to and seek help is another. As you can see here, the article in Forbes says that we have stated that healthcare coverage must include parts of this essential benefits package. The move to full practice authority for nurses is not slowing down. Some of you may or may not know that there's a legislation before the North Carolina legislature that will enable us to do that as well. But that is still continuing to move forward, and we're having some great success with that. Other things, we're following the scope of practice barriers. Those are being lifted so that we will be able to get more and more nurse practitioners out there to help alleviate the healthcare shortage as well. Affordable health care. Again, what we're talking about there is health care that should be available, that's preventive services supporting the cost effectiveness of that as well. The third one, quality health care. This is going to be determined by, again, having good qualified persons there, such as nurse practitioners and nurses in other advanced roles that will be able to help with that as well. I'm down to about 30 seconds and we're getting there. The workforce, again, Title VIII legislation, which leads to, this is federal dollars that leads toward training for more nurses, more nurse practitioners, and et cetera. Nurses who are going to agree to serve in these underserved areas are some of the most important areas as well. So again, we have that reauthorization has been there, but President Trump's budget is proposed to cut 64% of that budget, not only from that, but also from the NIH, which is where obviously a lot of research is being done as well. So we have a few stumbling blocks ahead of us, but we will get there. You as a consumer need to obviously put your voice into action. We know that as representatives are holding town hall meetings, you need to be there to voice your concern and obviously have that. So as we said, healthcare advocacy doesn't take a break, and it's extremely important that we get there. I'll just leave you one last thing. If you want to follow up, these are some websites for what we are doing as nurses. I'll be happy to meet with you after the presentation today and can give you those addresses as well. But together, we can all do it. Thank you very much.